Hi, this is Stephanie with Healthcare-Edu. I'm here to help you pass the CNA exam. Check out the link for our review course. But anyway, let's get right to it. I am going to make an occupied bed here. So I'm going to help you pass the skill. We're in Massachusetts. We start with the hand hygiene, Purell. We gather supplies, and the supplies are a fitted sheet, a flat sheet, and a pillowcase. You knock, 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 enter the room, close the privacy curtain. Of course, it's make pretend because I don't close the curtain so I can see my students. And you do your introduction. Hi, my name is Stephanie. I'm your CNA for today. I am here to make your bed. Is that all right?
Yes.
Can I see your ID? Okay, perfect. Every skill begins the same way. So now you are going to raise the bed. You've got to raise the bed to your height. So some beds are crank beds. Just look at the image, and then I'm going to lower the head of the bed. It was already low, so I'm going to lower the head of bed flat. If the patient cannot tolerate it, they don't have to be totally flat, okay? So I'm going to raise the bed. Let's let this work. The bed, this position is called supine, S-U-P-I-N-E. All right, when someone's flat on their back. Let me let this go up here. Now the side rail is going to go down. All right, so now I need to turn a patient correctly. This is how you turn a patient correctly. I'm just making space here. Hand on the ankle, hand on the knee, and bend. It's ankle and knee and bend. Then ask the patient to reach to the side rail as much as they can. Sometimes they can, sometimes they can't. Hand on the knee, hand on the shoulder, and turn. 1, 2, 3. There you go. That's how you turn a patient. Now I'm going to take this off. You have to get it all the way underneath, because if you don't, when you go to the other side, you'll be tucking and pulling on the sheet too much, causing friction and shear, which is what you want to avoid. You want to avoid friction and shear because it leads to pressure ulcers. So then now you take the new fitted sheet. Give me a second. I'm just finding the corners. I actually think it's like this. So I'm going to put this new corner on. Come up here, put this corner. All right, and this new sheet, I have to get it under the old sheet. And this makes a difference because if I don't do that correctly, I will have to pull too much on the other side, okay? So that you just gotta get right underneath the patient here. As much as you can, fix the sides. All right, and we'll pull, make sure that there aren't any wrinkles. Let me lift the corner here. Make sure, try to make our sheets smooth and wrinkle free. Side rail up, you have to, or else the patient will fall. So then I'll do knee and shoulder. I'm gonna turn you on your back and help the patient out. Ankle and knee, you can extend. Now go over to the other side, all right? So take your hamper and your bedside table. When you get here, side rail down, the white knob. All right, so now here you can move the call light, get it out of your way. You're always making sure this isn't wrapped underneath the patient. And again, ankle and knee, up, knee. Look, can you reach for the side rail a little bit? Knee and shoulder, 1, 2, 3, and turn to the other side. You can adjust the pillow. So now I'm going to move this old fitted sheet. All right, we roll it away from us. We don't touch it to our body. Put it right in the hamper. And this is the new sheet underneath. Now, if I didn't put it enough, I wouldn't have enough on this side. So you're gonna try your best here. The sheet's a little wrinkly. Obviously, coming from housekeeping, it would have been like ironed. But always make sure it's smooth and wrinkle free. Then you're gonna do shoulder and knee, lie you on your back, help the patient. All right, extend. Now this is the only time the patient's head is not on a pillow. You can go like this. I'm gonna lift up, sir. You could lie down. Now I'm going to take this off. You could set this down, and what you do is you take the new pillowcase, turn this inside out. Take the new pillowcase, turn it inside out, and what you're gonna do, you're gonna put your hand in the center, grab the pillow with the tag on the inside, line it up, and just like fold it right on over, okay? Do your best here. All right, if the door to the room was on that side, we never want the opening of the pillowcase to face it. So I would go like this, and I would say, all right, sir, 1, 2, 3, lift up. Now, even though he's not naked, we never want to expose the patient. So we're gonna take the new sheet with the wide hem up at the top. New sheet, wide hem up at the top. Can you hold this for me, sir? Straighten this out. You want a beautifully made bed. And now you're going to pull the old sheet out from underneath. And remember, I didn't have it turned or rolled into his body. Roll away from me so it doesn't touch my scrubs. Put in the hamper. Remember, you don't want to go too far because you don't want the patient to fall. Side rails up. I'll now come to the foot of the bed. Our patient's a little taller here. We're gonna tuck this in at the foot of the bed. You know when you go to the hotel and it's really, the bed is made and it's kind of really constricted when you get in the bed. They don't want you to have a pressure ulcer, so you make a toe pleat. They don't want pressure here, so you kind of pull this like so and just fold it over and make a little toe pleat, okay? It's just room so they can move. So finishing up steps, call light within reach. Call us if you need us. Bed low and locked. I'm gonna lower the bed in its lowest position. Are you comfortable, sir? Do you want the head of bed down or up? You're good? All right, bed is in the lowest position. I'm just making sure that it's locked. You have your call light, side rails are up, privacy curtains open. Most of the items can stay in the hamper because housekeeping usually comes to take care of that. And I'm gonna make sure he has his bedside table. The bed's in its lowest position, is locked. The patient has stated that he's comfortable. And so here's your bedside table. If you're ready, call me if you need me, okay? I'm gonna exit the room. I'm gonna hand hygiene and done.